Hello, my name is Presley Davis, and welcome to my presentation on the Community Health Systems Analysis for Native Americans in Arizona. Native Americans are among Arizona's most underserved populations, with many living in remote areas that limit access to health care. They face disproportionately high rates of chronic illnesses such as diabetes and heart disease when compared with the other populations. This presentation examines major health challenges, reviews available and missing services, and outlines a strategic plan to improve access and equity through culturally grounded, community-led approaches. Arizona is home to over 400,000 Native Americans across 22 federally recognized tribes. Many live in remote regions such as the Navajo, Hopi, and Tohono O'odham nations. According to the Arizona Department of Health Services, Native Americans experience disproportionately high rates of diabetes, heart disease, and suicide. Social determinants such as limited transportation, unemployment, and poverty continue to add to these disparities. Geographic isolation and cultural barriers further restrict access to consistent, high-quality health care. Health services for Native Americans in Arizona are provided primarily through the Indian Health Service, tribal health departments, and urban Indian health programs. While these systems offer essential primary care, funding limitations, provider shortages, and staff turnover often result in long wait times and reduced access to specialty and mental health care. For example, the Navajo Nation has only a few hospitals to serve tens of thousands of residents with limited telehealth and transportation options. The most pressing service gaps include behavioral and substance use treatment, maternal health programs, and chronic disease management. Native communities also need more culturally competent specialists, particularly in mental health and endocrinology. These gaps contribute to higher rates of preventable illness and mortality compared to the general Arizona population. My proposed strategy involves four key initiatives. First, expand telehealth infrastructure in tribal regions through partnership with universities and IHS. Second, launch mobile health units that deliver preventative and chronic disease services to remote communities. Third, invest in training Native youth to become health professionals through scholarship and mentorship programs. Finally, strengthen culturally grounded health education programs led by community health workers who understand local traditions. Implementing these programs requires compliance with federal and tribal laws. The Indian Healthcare Improvement Act and Snyder Act provide the legal foundation for Native health funding, while HIPAA regulations ensure patient privacy. Any initiative must honor tribal sovereignty, meaning that tribal councils must approve partnerships and all program designs. Public health agencies play a vital role in reducing health disparities through data collection, surveillance, and advocacy. In Arizona, the Department of Health Services and tribal health departments collaborate to monitor disease trends and apply for federal grants. Public health also promotes culturally appropriate prevention efforts such as nutrition and mental wellness programs rooted in traditional practices. In conclusion, Native Americans in Arizona face complex and long-standing health disparities driven by social, economic, and structural inequities. Expanding telehealth, training Native health professionals, and strengthening partnerships between tribes and public health agencies can improve access and outcomes. A community-driven approach that respects tribal sovereignty and cultural identity is essential to achieving true health equity for Native people in Arizona. Thank you for watching.